Hello, welcome back to the Brain Tap Business Journal podcast. I'm your host, Dr. Patrick Porter. And today I have a very special guest, someone I've been working with for a lot of years, actually, since I've known you since before the 2000s. So for people wondering about that, they're wondering, wow. And they know that Dr. Duresti, who I'm talking about, he's been on with us at Brain Tap many times, but now we have some really incredible news because we got his course put onto the Brain Tap Academy. So we're going to have links below where you can learn how to do this. I know that in the past, they'd have to come out live and learn how to do the technology we're going to talk about today. But a lot of you have talked about why it's so important that we work with chiropractors, especially neurologically based chiropractors, with the Brain Tap system. So Dr. Duresti has put together a very powerful course that trains people how to do something called the Cranial Release Technique. So Dr. Duresti, tell me a little bit about what caused you to create this technique and just kind of give us a little primer on what we're going to learn today about why it's so important that every chiropractor start to use this technique in their clinic.
Great. Well, thank you, Patrick. Happy New Year to you, your family, all the Brain Tap members. After I graduated chiropractic school in 1985, I went into a traditional hands-on, what we would call a straight chiropractic practice, my hands on your spine, with the concept to allow the body to function optimally, heal itself from inside out, do all the things that traditional chiropractic was based on. Later on in the career, I realized that I was missing something and I wasn't sure what it was that I was missing. So I started looking at different techniques, looking at different systems, and I realized really what I was missing was above the atlas, which is the first bone in the neck, resides the brain. And the brain is 80% of the nervous system. And I said, that's the only place really I'm not addressing with patients. So that then led me into this thing called cranial release, which is based on earlier works about 100 years ago from a Dr. Sutherland, who looked at the skull, said, why 22 bones? Why don't they fuse into one bone? And he determined that those bones stayed separate because they need to move. And this is a Hoberman sphere. This is what I like to use with patients and practitioners to explain that these 22 bones should in fact be moving. And because of stresses and traumas and the birth process and some other things that we'll get into, those bones can shift, can actually misalign. That negatively impacts this movement that's normal. And that normal movement, therefore, short circuits the brain, and optimal health is impossible. And when we met way back when, 20 years ago, more or less, again, I liked what you were doing because you were changing, as you said, the software inside, but I'm changing the hardware, the actual structure of the brain. So if the structure of the brain is off, there's never going to be proper function. And also, if the internal work, like what you're doing, if the software is off, well, I can probably work forever. And obviously, both together is a wonderful marriage. And that's why we're still together after 20-something years.
Yeah, it's so important. We've actually wrote a book together about it. So if they want to get that book too, they can find that on Amazon,
Yes.
Cranial Release Technique. But in the process of learning all of this, one thing that I was amazed, and I'm surprised that more chiropractors aren't doing this, because when you adjust these 22, really these plates that expand and contract in the brain, what happens if they don't correct that? Because a lot of times when we're working, especially with concussions now, you get a concussed brain, those get off cue or whatever. They're not able to breathe anymore because they're jacked up, just like a car fender would get jacked up. It was an accident. Tell us what happens. What could they be experiencing that maybe they're not getting the best results out of their chiropractic care or whatever care they're doing? Because you don't have to be a specific chiropractor to do this too. You can be anyone who puts their hands on, like a physical therapist or a massage therapist, someone like that. So tell us a little bit about what you're seeing out there and how someone would know that, hey, you're a good candidate for cranial release technique.
Right. Well, pretty much, I would say in all the years that I'm doing this, it would be next to zero of a patient that I could stand in front of me and feel that they would not need or they would not benefit from cranial release. So if you're a practitioner and you're doing your chiropractic, your acupuncture, your naturopathy, whatever it is that you're doing, you can enhance your results by adding the cranial release technique. because these bones shift and twist, there's certain things that we can just look at. Being trained in this and training myself in this and just looking all over, all I see is distortion. I see eyes that are not balanced. I see ears that are not balanced. I see distortion in the face, which tells me there's distortion in the cranium. And I just know right there, there's no way that this person could possibly go through life and function optimally. So I even pulled out my old plastic model of a fetal skull. So the point that I want to make here is that, I don't know if you could see this on your computer screens, but this is a plastic model of a fetal skull, and I called the company that made this, and this was actually modeled after a stillborn. And when you look at this head, all you see is distortion. You see one eye smaller. You see one eye lower. You see the entire cranium distorted. Now, this person might go through life and claim that they have good health, good blood pressure, they're good at sports, they're good on the computer, they're good at their job, but they're not functioning optimally. There's no way that they can be. And so by applying cranial release to this patient, or virtually any patient, that's going to enhance them at every single level of who they are. Because the first thing we learned in chiropractic school, the first thing you learn in medical school, the first thing you learn in dental school, the central nervous system controls and coordinates all functions in the body. So if the cranium is distorted, which it is virtually on everyone, then there's no way that you're functioning optimally. I, myself, have been having this work for years and years and years. I just received the cranial release 5 minutes ago. My wife is a massage therapist. I've been working with her since I started this work, so she knows what she's doing. She just worked on me, not because I have a problem, but because I want to optimize function. So if you're just open and looking for new things to add to your practice, and the beauty is, maybe we'll talk about it later, it literally takes a minute to do. I literally need the patient on a table or seated or in a hospital bed, or, as all chiropractors probably been called to someone's house, the patient's laying on the floor because they can't get up. You could do this technique in any position where you find the patient, and it literally takes about a minute to do. And that 1 minute can change so much. So
I know we've done many scans on the technique over the years, from using Dr. Barwell's device,
yes.
And also using our NeuroCheck, showing pre and post what happens to heart rate variability and how it helps the communication between the brain and the heart, which is so important and key in communication with the gut. So tell me a little bit about when you used to do this live. We used to go to your conferences all the time, but then as we all get better looking and more intelligent with age, you decided to do more remotely because we're traveling all over the world, and that keeps us pretty busy. But now they can learn it from their office, or they can learn it from their home. They can learn it from anywhere because it's available online now. Tell us a little bit about what you're finding with practitioners learning it online, and then is there still a way they can get skills training, or is this they do this and they just find, because they're already in clinical practice, they can practice it?
Right. Well, when I decided to put this online, I realized let me take everything that I have and put it onto an online platform, which is what I did. And I really didn't know how it was going to work out, quite honestly, because there is something about a live event, but yet the people then would say, well, gee, I have to leave my practice. I have to travel to the seminar and all the expenses that go with that. So I was pleasantly surprised, and we've trained quite a few people now, that people from all over the world that now go to the website, register for this training, start doing it. They give me feedback that they're getting the same results that all my other practitioners are. So truthfully, there is no need for me to be with you, but if they have questions, have concerns, they can always contact me. I'm very easy to reach. And we are considering doing some live events, maybe some one-day events where you've gone through all the training at home, you've started to use it, now you come to me and let me polish your skills a bit. And that's what's up in the air right now. So that may be coming later on down the road. Yes.
So tell us a little bit about, somebody goes to the site, which we're going to have the links below. so that you can get access to it. They're going to learn about not only the science about it, but they're going to see some art, right? You're going to demonstrate it too. So tell me a little bit about the science. We've already talked a little bit about that. Tell me about the art and how they're going to practice. They're going to see you performing this technique and seeing what happens with people that experience it.
Great. Chiropractic is based on the science, art, and philosophy. So those three ends of the triangle is really what I wanted to include in my program. So in the training, we go through the anatomy, the physiology, the philosophy behind why you should do it, who needs it. And in my opinion, from the time you're born until the time you leave this planet, you'd be better off with cranial release. The art of it, the actual putting your hands on the head. The other problem I had is when I go to shows, whether it's your show or the Master Circle, other shows that are out there, and I'm in my booth or my practitioners are in the booth doing the technique, it looks so simple. Like many things in life, it looks so simple. And I once had a chiropractor come up to me and he said, anything that looks that simple must be very complicated. And boy, did he say something important to him and to me, because it's so specific. It's got to be done just right. But we spend so much time getting the video just right to explain this to the practitioner so that there is absolutely no questions to what to do, when to do, how to do it, when not to do it. All the questions that I have some practitioners that purchase the program, go through it over a weekend, and Monday morning they're starting to use it in practice. I have other people that very slow walk it, take a month or two, work on friends and family, then bring it into practice. It really depends on your personality, the type of person that you want to. If you're a gung-ho person, you could, in theory, learn Saturday morning and bring it into the practice on Sunday. So there's really nothing. I gave you all the manuals, all the charts, everything. And the other thing that you mentioned, Patrick, about connecting the brain with the body, the brain with the heart. The one other aspect that cranial release does, which I haven't seen anything else in my profession that does it, maybe this thing's out there, it also connects the hemispheres, the right and left hemisphere. So many times when you check a patient, when you're a practitioner and you're working on a patient, you see one leg short, you see one shoulder high, you see distortion within the body. If you apply the cranial release and you apply it correctly because you've been trained, 9 out of 10 times you're going to see an improvement in that structure. And you didn't touch the back, you didn't touch the neck, you didn't touch the spine at all. But by balancing the hemispheres, you balance the muscular system, you balance the structure. So that's another way, and that's a very nice way to practice. If I were going back into practice today, I would base my whole practice on stress and the handling of stress and the negative effects of stress and how cranial release could help you with that, along with the brain tap. That's a 1-2 combination. That's all you would really need to do. That's all I would do. In practice, before I left practice, that's all I was doing. So the patient that came in with a rip-roaring sciatica, the only thing I did was go to the head. The person with a knee issue, an ankle problem, an elbow problem, shoulder problem, migraines, the only thing I did was cranial release, because once I did that, once I corrected the cranium, I found very little, if not anything, to do after that. So it really will enhance anything that you're currently using in practice.
Yeah. And those of you that are brain tap doctors out there that are using brain tap, we've done so many tests that show, hey, do the cranial release technique first, then have them do the 10 to 15 or 20-minute session, depending on how much time they have, to set that, because like you're saying, that right and left hemisphere, we've shown it in real time how the brain responds. It's pretty incredible, when you see the brain light up like that. And then the innate intelligence takes over. And if we can get that neuroplasticity to take place, we got some magic happening there, and you're able to measure it. So if you have the neurocheck and you're a brain tap doctor, this is another technique that we've shown in front of groups. You take a risk every time, because some people, like any technique, they're going to have a little bit of a stress response. But in this one, we know, like our techniques, like brain tap, usually 90% of the people are going to have a positive response. The other 10, that shows that their nervous system isn't regulating. A lot of people are so stuck, their physiology is stuck. And now we're talking about these 22 bones in the cranium, that we can get those moving. So let's go back and let's pretend, because when you're at a trade show, it's a very different scenario, right? You've got a line every time. you've got two tables, you got two big lines. If you got three, you got three big lines. It seems like the doctors, when you go to events, they know about this technique or they want to experience that.
Yeah.
So part of the process here is, how do we explain something that's so powerful? Like you said, it's so, when somebody looks at it from a distance, they think it's easy. Like a couple of our staff members, I remember when I first brought them in, they started playing with it. I said, hey guys, it's not, they didn't know exactly what they were doing. So, but once the doctors, what really sold me on it was all of the doctors lined up to get this treatment every time. It's like every show you went to, you guys were so busy, just one after the other, boom, 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 seeing these doctors. And if it didn't work, they wouldn't be lined up like that. So how do you explain something like this to a doctor that might not have ever seen it or experienced it, so they can at least start to explore it to see if this is a technique they want to bring into their practice?
Well, the nice thing is, especially when I go to these events and the doctors come up, they'll tell me, I always need an adjustment here, and they'll mention the bones, and it seems like the subluxation pattern keeps repeating over and over and over. And I saw that in practice for many years as well. When you address the cranium, and again, the actual technique is basically 99% of the time, the patient lies on their back. It's a very gentle technique. It's something completely different in that I'm not adjusting a segment as we would do in chiropractic. I'm not adjusting the atlas or the fourth thoracic or whatever it happens to be. I'm looking at the cranium as a dynamic, living structure that's doing the best it can to breathe fully, but because of the misalignment is restricted. So all doctors really would have to do is, after you watch this video, just go in front of a mirror and look at your own eyes, and you'll probably notice that one eye is lower than the other, one eye looks smaller than the other, and just look at yourself, or even take a picture of yourself and look at the picture. Look at your patients, look at people on television. And everywhere you look, you'll start to see distortion. And that distortion is just a sign of cranial imbalance, cranial distortion. And that person would benefit from the cranial release technique. And it's a very gentle technique. There are no instruments. I had a lot of questions in the few videos I did previously about balloons in the nose, which we don't use in cranial release. I know other practitioners do. I have nothing against it. I don't know anything about it. I don't comment on things I don't know. I know what I know, and I know cranial release. So that's the corner that I stick to. And it's very gentle. And a lot of the chiropractors in particular that are used to heavy adjusting, that as we get older, maybe we don't like that as much, or we have patients that don't like that as much. It fits in well with a kind of a soft tissue sort of approach, a very soft touch, or a very osseous type of hard adjustment. So it's very gentle, it's very effective, and that's why the doctors, if I come on a Thursday, they want to see me on a Friday and the Saturday before they go back home. So
yeah, it's been natural. Nice. I mean, let's talk a little bit about when you're talking about the spinal fluid washing over the brain. A lot of people don't understand why that's so important in that pumping action and for detox, right? Because it could be trauma, thoughts, or toxins, right? And you're hitting all three of those with this technique, especially if you add the brain tap at the end. So tell us a little bit about what's and why it's so important. A lot of people don't realize how the brain actually gets rid of toxins. So tell us a little bit about that.
Right. Well, again, all we're doing in cranial release is bringing this back to its natural state, and its natural state of the cranium is movement. So again, less movement means less pumping, means less detox, means less all the things that you mentioned. So we want to maximize that movement. And again, the earlier we could get to a patient, the better. So ideally, we want to get to the baby while, as soon as delivery happens, you want to get to the baby to maximize the movement. But if you're 90 years old, I still want you on the table to maximize the movement and to maximize blood flow, maximize cerebrospinal fluid flow, maximize life, maximize everything with cranial release.
Yeah, it's so important. A lot of people are looking at breath work right now as such a maximum, and so it is powerful. We know it's very positive. But if those 22 bones are jacked up, you can actually get a headache doing it, or other pains, because it's not doing the right thing, right? It's all together, because we believe that number 2 is movement in health at BrainTap. Number 1 is nutrition. You cannot think a bad diet. Number 2 is movement. That's why things like Tai Chi and yoga are so good. But you've got to liberate those bones so that this other work you do, whether if it's even walking, walking is going to help to build this, because you're starting to breathe and get the lymphatic system in there. So what would you say to somebody that's right now going, I've got 15 techniques. Techniques aren't my problem, but they don't have anything from the neck up really, other than to adjust that atlas. So what would you say to them if they walked up to your booth?
Well, I would say, the nice thing is, because if they go to BrainTap Academy and they watch the video that I put there, I go through the entire anatomical breakdown of why this makes so much sense. We all have different techniques. We've all adjusted the right bone at the right time in the right place, and had what many people would call a come to Jesus experience. I just found that doing the cranial release, and the practitioners that use cranial release have that response much more frequent. It's just something that just makes so much sense. And then you want to go in and adjust them osseously. You want to do acupuncture. You want to do breath work. You want to do brain tap. You want to do reflexology. Whatever you want to do is a perfect secondary after you sort of set the table with the cranial release technique.
What's so nice is to see somebody who's in high sympathetic. I mean, they don't even realize it. They believe this is normal for them. And then you do the adjustment, and then we look at them and they just they just have this release that happens.
It's so just like you let all the air out of the balloon. Exactly right. Yes. Yeah. And the nice thing is, the reason why I used to like to go to the different events is because you work on someone Thursday or Friday. I want them to go through a sleep, because once you go through the sleep, that really sort of kickstarts this movement. Then they come back the next day, and that's really when they're going to feel the full effects of the cranial release. And whether it's that they are dreaming in color, whether that I had the best night's sleep ever, whether I didn't wake up to go to the bathroom at night like I usually do, all these different things that you hear is because now you change something at the very core of their physiology, which is this cranial motion, which really most of the world is still not even aware of. And that's what cranial release is here to do, to sort of educate people and educate practitioners about this whole concept.
I know that our team, including myself, we would go over, and it was almost like everything got just a little bit brighter, kind of like that commercial. Yes. We don't make the colors, but make them a little bit brighter. It's like you turned on that switch that you talk about. And I talk about turning on that thriving brain. So this is a technique that gets them out of that survivor mode, because when the brain is damaged or it's misaligned, just like we know about the spine, but if we can start from the top down, you started off the conversation that way. It's from the top down, inside out. We've got to correct these things. So what if I forgot to ask you about cranial release technique that you want the listeners, or what would you like to reinforce that you've already mentioned?
I think we pretty much covered everything. I would say certainly go to the BrainTap Academy, watch that video that I put up there where I go through all my slides, where we cover everything. Feel free to go to my website, cranialrelease.com. There's more information there. Feel free to go to my YouTube channel, Cranial Release. I think we sort of covered everything. At the end of the day, my job with that patient is to take them from where they are and get these bones moving again. And there's one key that picks the lock. And I found what that is, and that's cranial release. That opens this whole system. And then just so that we're 100% clear on one other aspect, it's not something that you do once and never go back. It's something that's done on a regular basis, because as soon as I work on you, you're going to go back into the real world. The physical, chemical, emotional, EMF stress, relationships, diet, all the other stresses are going to build back up. And I'm going to see you on a regular basis, and we're going to maintain this normal movement with cranial release, and we're going to find out what works best for you based on your body's telling me, through your neurology, through your nervous system, telling me by different checks that I teach you, how do we optimize function? And that's what cranial release is all about.
Well, Dr. Duresti, the creator of the cranial release technique, has spent some time with us, sharing with us about why it's necessary to release these 22 bones. And you have an opportunity to go to BrainTap Academy. The links will be below. Go there, check it out. If you're not using this technique, this is a very valuable technique. It could be the one that you start off, like you said, with every person who comes in. Then if you want to, be like a surgeon, I guess, and go into the other areas, you can do that. But the reality is that this is a technique. I know it doesn't take that long to administer. You can do it as a PA, as a massage therapist, as a chiropractor, as a DO, whatever. If you want to learn this technique, you can learn it from the comfort of your own home, your office. Dr. Bill's done a great job putting it together. I've met many of your people out there in the field, and we actually have them at the BrainTap booth a lot, because a lot of times we can't get the movement, or we see somebody is so stressed out, or there's a problem. I love having your guys around, because we can say, hey, go get the cranial release and come back, because sometimes it's not all about your psychology. It's about your physiology, and we're right now, when people aren't getting the movement, especially after what's happened after the last 2 years, we got to get people moving and breathing again, because really in liberating those 22 cranial bones that we're talking about. So Dr. Bill, thanks for spending your time with us here. And I know it's going to be a great new year. We're going to get our doctors learning more and more about cranial release, because it fits so perfectly in, like you said, with BrainTap. It's a technique you can do. Maybe, like you said, a minute, 2 minutes, maybe at max. You do that technique now while they're getting that neuroplasticity that's happening. We know that, BJ Palmer talked about an hour. He wouldn't let his people leave his clinic for an hour. They'd lay on a bench, because after that adjustment is the most critical time for neuroplasticity. And that means better memory, better concentration, better sleep, better focus, all the things we want to improve with BrainTap. We can set up the physiology to do it. So as a BrainTap doctor, I can't recommend this enough. That's why we have it on BrainTap Academy. You can also do the technique and then use laser. A lot of people are doing that. We see that all the time, because that laser is also going to accelerate that neuroplasticity, because you're going to bring blood flow circulation back to that area now that it's not all jacked up. So again, Dr. Bill, thank you for being here. We're going to get this out to BrainTap Nation, get them using this technique, because it's something that, they'll have lines just like you do at your trade shows. They'll have those lines in their offices, because people get this incredible results. It's easy on the practitioner. That's what I like. And then it's also easy on the end user. I do it every time I'm with you or around you, or some of your people are at the shows. We always get it done. It's an incredible technique. I wish that I was able to do it on myself, but I'm not. So we need to get somebody here in New Bern.
Unfortunately, that is the one thing. You cannot do it to yourself. So you have to find a practitioner. Even I need to go to somebody. So that's a good point. Thank you, Patrick.
All right. Well, again, you've listened to the BrainTap Business Journal podcast. This was all about cranial release technique, how that technique works so powerfully before the BrainTap session to create that neuroplastic change and the transformation that we're all wanting for each of our clients and patients out there. So again, thanks for listening. We're out to better a billion brains. Right now, it's your brain that's listening. So thank you very much. Please share this with any practitioner you know, especially chiropractors, DOs, PTs, massage therapist, anyone you know that might be a practitioner, because once they learn it, guess what? You can then go get it done by them, because it, like we were saying earlier, this is a technique you really can't self-adjust. You shouldn't be doing that anyway, but if you can't do that anyway. So thanks again.
One thing, if I can just say one thing, Patrick, you mentioned that list of practitioners. The whole other group of practitioners that I've always been interested in and that are now looking at my work are dentists.
Oh, great.
In particular, because they deal with the TMJ, and of course the TMJ, where the jaw joins the temporal bone of the skull, they're working only here in the mouth. They're not realizing if the temporal bones are distorted, the TMJ can't be aligned properly. So I have dentists now that are looking, saying, wow, I can do this, and it's helping with the TMJ patients with the overall oral health. So again, any practitioner that puts hands on patients, you can include CRT, and that would just help your patients and help your practice as well.
Right, and there's a whole group of dentists that are all about sleep dentistry, because you go to your dentist twice a year, you only go to your main practitioner once a year, right? So dentists are really good. So yeah, we need to get the dentist out there, and there's a number of dentists now getting into more holistic dentistry.
Yes.
And if they can work with one simple technique to help realign that jaw. And the main thing is that I think people will find themselves sleeping better. With 2/3 of the world not sleeping, this is a core technique to get people back sleeping. So
Absolutely. Yes. Thank you, Patrick. I appreciate it. Happy New Year, everybody.
Happy New Year, and tune in to the next BrainTap Business Journal podcast. Thank you for staying with us here.